top story at this hour is that flights to and from United Kingdom have been banned till December 31st over the new fast-speeding strain of the coronavirus in the country. And the government has said today that several countries have announced similar move as well, and the ban will come into effect on Wednesday, and all the passengers arriving from UK before then will be tested at the airports as well. There was a joint monitoring group of Covid-19 that met this morning to discuss the mutant coronavirus that is the talk of the town, has impacted everything from flight movement to even the stock market. But we'll talk about that in just a bit. Just at the moment, talking about how it has impacted and what all countries it has impacted so far. Well, UK has been talking about cases skyrocketing under this new variant of the virus. Canada, Saudi Arabia and several other EU countries have also suspended flights from United Kingdom over the new strain, believed to be 70% more infectious. Much is unknown about the strain, but experts say that current vaccines should be still effective against it. That should being the operative word over here. But first up, let's go cross live to my colleague Sukirti Dwivedi to try and understand what really went behind this decision. Sukirti, the big question at this point is that this variant was the first spotted around 4 months ago in September in the United Kingdom. The country, India, at the moment has decided to ban flights only from day after. But at this point, is there any sort of mechanism to trace and try and check in on the travellers who've come from UK in the past as well, but because they could be spreading the virus as well, unknowingly?
Well, yes, Sonal, it is true that passengers from the UK have been coming in for the last several months, at least to the facilitated by the Aviation Ministry. The Union government at this point of time has not given any clarity on whether they will start tracing all of these passengers that have come in the last few months since September, because around 20th September is when this new virus strain was detected in UK. So since then, how many people have arrived in India? No clarity on that yet, but the health secretary at this point of time saying that all of these flights that land in India till tomorrow night, because from 22nd December night the ban will begin. Till that point, all those flights that arrive, people will be tested through RT-PCR, and all those that test negative will be sent for home isolation for 7 days. But no clarity yet on all those passengers that have arrived so far from the UK. We look at the Vande Bharat figures, at least in the last 1 or 2 days, there are at least 700 passengers or so that arrive on a daily basis through the Vande Bharat flights. But the MEA, the External Affairs Ministry or the Aviation Ministry, yet to give out any complete data of how many have arrived since September.
And Sukirti, is there any indication that this flight ban could actually extend not just from UK but from other countries as well? We actually have information at least 9 other countries where the variant has been detected as well.
Well, this is a developing situation at this point of time. For now, the Civil Aviation Ministry has decided that the suspension will go on till 31st of December, but they will definitely be keeping a close watch on the containment measures, and if there is a need that they feel that they need to extend the suspension, then that call would be taken around the 1st of January or a day before. So that would be seen only at the end of this year, but so far it's till 31st of December, but definitely this situation will be under review by the ministry.
All right. Thanks, Sukirti, for that update. Let's go across to our guest this evening now. We've got Vidisha Madan. She is a student at King's College, London, joining us over there. We also have Dr. Vikram. He is also joining us from London at this point. He's a MD and PhD in the University of London, Associate Specialist in the Reproductive Medicine at UCLH. We also have Dr. Rakesh Verma, Additional Director General of Health Services in the Government of India. Thank you so much, sir, for coming back on the show. Vidisha, first to you. You look particularly stressed right now. Tell me what's going on. What is the scene at the moment? Has this flight ban impacted you and several other students like you?
Yes, 100% it has. A lot of my friends were planning to go back in Christmas, and now they just can't because there's a flight ban until the 31st. So there's a lot of uncertainty as to whether it's going to extend or not, and if they'll be able to go back in January or if they're stuck here for the Christmas break. So yeah, there's a lot of stress.
I know, I can see that on your face, but tell me, how bad is the situation there at the moment? You are, where exactly are you at the moment? And is there nobody on the streets? Give us a view of what's London looking like at the moment.
I'm in London right now, and in Westminster to be specific. There are a lot of people on the streets not wearing masks, and it's particularly concerning because there are a lot of people, and it's just when you go out wearing masks and no one else is wearing masks, it's just disheartening to see that no one else is following the rules. So yeah.
All right. Okay, that's a worrying sign, and perhaps the first we've heard of it from London, at least, where people, despite this new variant, are not wearing masks. Vidisha, stay on with us. I'll come back to you. I also have Dr. Behel joining us now. He's an aviation expert. But before I go to him, Dr. Rakesh Verma, just to get an understanding from you from the government side, we see a travel ban come in at a time India has imposed it one more time, but only for UK. When the variant has already been seen in at least 9 countries, is this a time when the government needs to get a little more proactive, especially keeping in mind the nature of this variant, which transmits 70% more?
See, this is a very pertinent and very nice question that you have raised, but I must try to remind you, the government of India from day one is very conscious and responsible for its responsibility, which at the highest level of the government, from Honorable Prime Minister, Honorable Health Minister, Honorable Health Secretary, they have taken it till to date among the best way possible. It has been, government is very conscious for his responsibility for his
Sure,
citizens.
sir, but we have to learn from how we've dealt with the virus so far.
As of now, the maximum variation in the strain has been found in UK. And that is more virulent, more harmful, and this is an unpredictable new virus. So government is taking all steps possible to save its citizen, protect them from new onslaught of coronavirus, and in case of requirement, they will do more. This I can assure you, government is fully geared up to meet any contingency whatsoever it may come. And till to date, you must remember, India has cured about 1 crore of patients, and our mortality rate remains the least in the world. We are very proud of that, but we are very conscious of our continuing responsibility, which the government has to discharge for next couple of months or maybe year.
All right. Dr. Vikram Tolkar, thank you so much for speaking with NDTV. Just describe for our viewers, when we look at this current strain of virus and everything that we know about it, the one underlining factor is the spike protein. Just tell our viewers, what exactly does it mean? Why is this strain more harmful than the other variants we've seen so far?
Thanks, Sonal. Thanks for having me on the show. So viruses are known to mutate. Almost all viruses mutate when they are making their own copies. This particular virus, which is coronavirus, has got a protein on its surface, which we call as the spike protein. And it's the spike protein which has a particular place on it with a receptor, which is called as a receptor binding protein that attaches to the human cells. This is where it makes entry into the human cell and then makes multiple copies of itself. So it keeps spreading in the body. That's how it infects the whole body. Now, there are changes which have been noted in this particular spike protein area, about 17 to 23 sort of changes in the genetic code. And this is what is worrying. This is the new strain that has got these changes. So it's able to bind the cells more effectively, enter the cells more effectively, so it can infect more people and transmit quickly. That's why you're hearing the figures between 70%, a little bit less or a little bit more estimates of how quickly it can spread.
So having understood that part about this new variant, what would your recommendation be to governments who are trying to understand more about this virus and thus take action? Do you think this is the time when more and more travel bans should be imposed, just keeping the nature of this new strain in mind?
I think the answer to that is yes. We've learned a lot over the last 1 year with this virus, and it might even throw up more mutations in the future. But given where we are now and the new strain, I think it's critical to go fast and go hard. Almost all countries which have actually adopted this particular style of just going fast, going hard, and blocking all the entry of people who could potentially be spreading this virus without knowing.
All entries being the operative point there, because India has only blocked UK. There are 8 other countries where the virus has been found as well.
That's right. and you won't be able to stop this virus or this particular strain going to other countries. You can make your best to slow down the entry, try and gain some time so that you can prepare for dealing with this particular strain. But the point again, as you're raising, is absolutely vital. Is you go fast, go hard, block the entry, and try and save people from catching this virus very quickly.
All right. Let me get in Dr. Behel as well. He's an aviation expert. Not very good news for you, sir. We were just getting back to the point where people were going back on flights, but this has put everything on hold one more time, at least to start with on UK. How do you see this going forward, sir?
Thank you, Sonal, for inviting me to your show. I'm very, very impressed with the kind of dialogue that has taken place till now. And as everybody has said, it's not just India. It's France, Germany, Italy, Belgium, Denmark, Bulgaria, the Irish Republic, Turkey, Canada, Hong Kong, Iran, Kuwait. I mean, just name it. A large number of countries have banned their flights originating from UK. Yes, it is bad news for aviation that we are in that air bubble strategy where we are not going to allow the flights to come from London because of this highly virulent strain, and it is one of those highly infectious strains of COVID-19 where the rate of infection is between 0.4 and 0.9. I want to tell you that in the aircraft is still the safest mode of travel. Why is it safest? Is because it has the air purification systems which are known as high efficiency particulate air filters. Now these high efficiency particulate air filters are able to remove most strains of COVID-19 because they can catch the particles below 0.2 microns also with their diffusional interception technique. So it is not that the aircraft is not the safe. I mean, aircraft is the safest mode of travel, but the best way to prevent a virus from coming into the country is to block the source from where it is coming. So we highly respect the decision of the government, which is for protection of our citizens.
Let me quickly take Dr. Vikram again on the point where you say that the filters on the aircraft are enough to keep away these virus strains as well. Dr. Vikram, your point?
Yes, I think I would agree with that. In one way, you're trying to make sure that you can ensure the safest environment for the passengers. But it's not just the aircraft, though. Remember that you're going to have people coming to airports, going to spend time on airports. There'll be a collection of people getting together when you're boarding or when you're deplaning. So in a way, any sort of air travel will bring people together and transport the virus from one place to the other, whoever is infected at that particular point. So overall, the strategy still has to be no air travel when the area has been identified to be carrying this particular strain. And I think that's what you're seeing across the board.
Right. Yeah. Dr. Vikram, one very important point I just wanted to understand. So we've been reporting, and UK and WHO has also talked about how the virus was actually first spotted in September. That's 4 months ago. Yeah. And since that time, it could have actually spread quite further. We finally gone into a ban, but only with UK. What do you think is the best means to try and block all our gateways to this? Is the way forward that India perhaps needs to contact trace, go and check on all travellers who've come in from these countries so far? Is that an exercise that we need to get to, or what is the best way to fight it out?
Well, I think you kind of have to put this into perspective. So the virus will keep mutating. In fact, the virus that started in Wuhan is hardly the virus you're seeing all across the world now. It's had hundreds and hundreds of mutations within its genetic code. So the virus that we are talking about now was first identified in September, but nobody knew whether this is one of those mutations like the 100 others that would be important. We only now know after monitoring the data for the last, say, 4 to 6 weeks, that it's now becoming the dominant strain. It's kind of overtaking all the other small mutated strains this virus has. So the tracing, the contact tracing and treating and isolating, of course, has to be the key. You've got to try and trace as many people as you can. In ideal world, everybody has to be traced in terms of any symptoms or any potential travel that could be carrying this virus. But how much can you do that has to be balanced against the resources. So it's always going to be a kind of race between how many people can you test, how many people can you vaccinate faster than how many people this virus can infect on a given day.
Right. In fact, all you gentlemen and Vidisha, thank you so much for joining us. Vidisha, saddest for all of you who are stuck in UK at this point. You know, lots of hugs and everything to people, and especially students who are stuck there. Vidisha, quickly, last word to you on what you would like to say to all the others at this point. Of course, safety is taking priority over the holiday season at the moment.
I would like to say that Tier 4 is actually something that was needed due to the new mutant. So I'm actually glad that there's a travel ban so that it doesn't spread in India and very selfishly does not go to my family or my friends. So I'm glad that there's a travel ban and there's a tier 4 so that it doesn't spread all over the world again.
Right, good to hear that. I believe I have some more time. Dr. Rakesh Sharma had a point to make. Go ahead, sir.
I still want to say, irrespective of whether it's the original Wuhan virus or mutation virus, our protection cannot be loosened. That is, wearing a mask always, almost always, remaining within the confines of your home or your office unless it's really mandatory to get out. When you're meeting a new person or a stranger, use a handkerchief, use a mask, and don't look at his face so that his cough, his sneeze doesn't come on you. And whenever you're touching a new surface, new book, new door handle, road railing, please do not hesitate in cleaning your hands very nicely with any soap, or if soap is not available, please maintain a sanitizer to clean your hands, because this virus will come from one person to another person only by speech, only by cough, only by sneeze, or by shaking of the hands, or by using touching surface, which is new, undoubtedly. But at the same time, don't get panic. This is a dreading disease, but Government of India and its doctors, its nurses, its paramedics, private hospitals, all are fully geared up to combat the new virus or the mutated virus or the virus in the way it comes. So respect the disease, please don't get panicked. I can assure you that our hospitals, whether in the private sector or in the government sector or in the corporate sectors, and all the government, from state government, district government to national government, are fully equipped and geared up to assist and serve its citizen with full confidence, full energy, and full resources.
All right,
so please
that's good
don't
to
get
hear.
panicked.
That's very, very good to hear. Dr. Vikram, one more question I had, which is probably on everybody's mind at the moment, which is, has this new strain extended perhaps or impacted the timeline of the vaccine, especially the one that arrives in India? I know there are no easy answers here. There is very little that we knew about this new strain just yet, but what do we know so far?
Well, I think it shouldn't affect the current vaccination plans. We know that this vaccine, the vaccine from AstraZeneca Oxford, which is really the main contender for vaccination in India, I think it's likely to get approval just before the year end. And hopefully in India, simultaneously around, say, first couple of weeks in January. If that happens, then that's great. That should continue, because so far even the new strain hopefully is responsive to the vaccines that are currently available, whether it's Pfizer, Moderna, or AstraZeneca. So the vaccination should continue hand in hand. In fact, we should be trying to get them across as quickly as possible, because as I said, it's a race against this virus spreading versus how many people can you get vaccinated.
Right.
Of course, challenges and a lot of unknowns in terms of long-term immunity. But as I said, it has to be rolled out simultaneously with this virus spreading around.
All right, Dr. Vikram, Dr. Verma, Dr. Behel and Vidisha, thank you all so much. Good luck, happy holidays, whatever is left of it at least so far.